Chief, each year the CDC and the National Institute of Health report drownings as the #1 leading cause of death, unintentional deaths in children ages 1 to 4. All the experts agree that the most effective way to reduce and eliminate this risk is through public education and public awareness. This has the added benefit to us as a fire department as being one of the least expensive community risk reduction programs that we can roll out. It also will increase our public image positively in the community and have an impact on our public relations with the community, and at the same time, probably most importantly, save the lives of children in our community. It's our duty to protect those that are vulnerable, and I can't think of a more worthy group to apply our efforts toward than kids. So if I have everyone's attention and would like to hear about briefly how we would go about rolling this program out, tracking our success, and the anticipated results we think this program can have, I can go into that now. So to roll this program out is a 6-step process. You identify the risks, then you prioritize the risks, which we have already done by identifying at-home child pool safety as a risk, and then prioritizing that as being the one that we want to pursue. So that takes us to our 3rd step, which is you develop strategies and tactics to mitigate that risk. To do that, a common way is through they call it the 5 E's, which are 5 E's prevention model. The 5 E's are education, engineering, enforcement, economic incentives, and emergency response. For this program, we're going to primarily and heavily focus on education because that is unanimously the most effective way to reduce childhood drownings in the community. We offer a little bit of an economic incentive in that operations crews will be providing at-home pool and water safety home inspections upon request or when a need for it is seen in the community or on a call, similar to how we identify smoke alarm install program now. As far as enforcement goes, we're not really going to touch on that because they're privately owned homes and there's no building or fire code for them, and that's not really the interactions that we're looking to have with the public anyways. As far as engineering, there are some advances out there. Engineering would refer to like seat belts, bicycle helmets. There's gates for pools, there's pool alarms, but they're not in a price range that would be realistic for AFD to give out to the community at scale. So primarily we are going to be focusing on education. So from there, the next step 5, is to implement the community risk reduction program. For this, it's also a 6-step strategy for implementing it. The first one is to identify and allocate resources, which we have done. We will need pamphlets, informative pamphlets for all operation companies to have and pass out to the community to get as much information to as many people as we can in the community, because that is going to be our most effective strategy at reducing drownings. We also are requesting a budget for promotional toys to help with awareness. They're floating fire trucks. They're $6 a unit. Those are really the only 2 expenses, and it's a rough estimate for an annual budget of this program to operate between all of those things would be $6,120. The next thing we do is assign responsibility. This is going to rely heavily on operations because they will be the ones interacting and getting the information out there to the community, as well as performing the inspections. And then our public education department, we're going to ask that they are kind of a centralized location for all information, contact info, referrals, as far as to American Red Cross Association, offering free pool safety tips in a course to parents and caregivers. So we will rely heavily on those two with assigning responsibilities. We're going to communicate our goals through established timelines and milestones, and what we think this program can achieve. And then through already established timelines, we are going to be able to monitor progress by seeing if we are hitting the intended milestones within on time of our initial projections, or if we're ahead or behind of time, and also where those areas that are lacking are located and who's responsible for those, as well as the ones that are excelling, and we can invest more into those areas. After that, the sixth step is to make adjustments as necessary, which we will analyze the data, and especially having that centralized location to kind of track everything. We will see, we'll be able to make adjustments to make the program more effective. The sixth step is to monitor, evaluate, and modify the plan, which kind of goes along with making the necessary adjustments. We will be able to track our goals year by year, of all the things that we want to hit, and to see if we're making those timelines or not, see why we aren't and who's responsible for those areas that we aren't, and make adjustments as necessary to make sure that we are as getting the results that we expect this program can have. Thank you.